Hey, this is a wrist taping technique that I find can be helpful for a variety of wrist and even elbow issues. So I'll show the technique and then I'll talk a bit about it. So one thing I've changed over the years is I've started using kinesio tape here rather than a stiffer tape. I just find it hugs the wrist a little better. It's a little more comfortable, and kinesio tape is pretty widely available. And so this is stretchy tape, so I'm going to leave a little bit out, and I'm going to anchor the first part with no tension. And I'll show this here, but I'm trying to come up onto my palm a bit, but without interfering too much with the action of my palm. So that's got no stretch. And then I'm going to take this tape, I'm going to make a light fist. That makes my wrist just a little bit wider, so I'm less likely to cut off circulation. And I'm just going to come around the wrist with about 50% kind of light to moderate tension, and I'm going to overlap that and come down on there. So that's piece number one, and I'm just going to do the same thing as best I can remember, going in the opposite direction. If you don't go in the opposite direction, you lay them down in the same direction, probably going to be fine, but as best I can, I like to go both ways. And so certainly you can have somebody else do this, but with a little practice, you can get on your own. So I'm going to lay that down there, and then I'm just going to get this up. Sometimes it's a little tricky to get the paper off, but there we go. And I'm going to run it around and apply a little tension. You can play with how much tension. If your hand starts going numb, if you don't have capillary refill, anything starts to hurt on there, loosen it up a bit. But that's the technique. And so what we're doing here is a few things. The wrist has 8 bones in this small space, and they all have to move but also become stable when we're gripping things. And so the muscles on all around the wrist, many of which go to the elbow, they do various specific motions. So like the wrist extensors bring my wrist up and out to the side, they lift my fingers up, but they also, when I grip something, they play a role to stabilize these bones. So the wrist and the foot and ankle are kind of engineering marbles in that they're mobile, but then they can become stiff when we need it to. However, if something is painful at the wrist or hand or up into the elbow, then promoting some stability of the wrist can be a really helpful tool to let some things calm down, and lets the muscles that stabilize it maybe take a load off a little bit. So this I find helpful as just a kind of first simple line of treatment for a variety of wrist and hand type pain. And then also into like some of the tennis or golfer's elbows, some of the elbow tendon pain. I've started going to this too because it's easy to apply, but often I find it just reduces a bit of the load on these tendons because they're not working as much to stabilize the wrist joint. Because all of the muscles that become painful in like a lateral medial or elbow tendon issue, they almost all have a role to play stabilizing the wrist. And so it's a bit harder to tape up here. We can do it, and I have done it, but it's easier to go here, and it's a little bit more of a catch-all where it kind of catches all of these tendons that come up to the elbow as they cross the wrist as well. So of course, check with your healthcare provider if you're going through an injury to make sure this is right for you. Take it off if it makes anything feel worse. If you took a hard fall onto an outstretched arm, that's a time where you might want to check to make sure you don't have a fracture. But for a lot of overuse type pain we know that isn't a fracture, or things that hurt as we're gripping, especially as the arm moves away from us, this can be really helpful. It also is going to limit motion a bit into the end ranges, which sometimes can be a helpful reminder if we're trying to avoid different triggering movements. So any type of tape can work, but I've been liking the kinesio tape because it just hugs the wrist without too many wrinkles, stays on pretty well. You can find this at pretty much any pharmacy. I don't have a brand preference, but usually comes in pre-cut strips. 2 of them works well. So give it a shot, and if it's helpful, use it as much as you need to calm things down. And then I like to use it during potentially provocative activities. So during a training session, or during a time at work when you're going to have to be using your hands a lot, something like that. Give it a shot. Let me know how it goes.